we should do a word of the day.
Yeah, like what? How do you say pheochromocytoma? Like what?
Pheochromocytoma. Honestly, I practiced before I got on the podcast.
Did you? Yeah, no,
Well, you
that's
got to
a
use it then.
Malvina Ibrahim is a patient education specialist at SeamlessMD, where she designs interactive digital care plans for patients, including endocrine surgery. Malvina has 2 Bachelor of Science degrees, the first in health studies with an emphasis on public health, and the second in nutrition and dietetics, and a Master's of Health Science and Nutrition Communication from Ryerson University. As a registered dietitian, her passion lies in contributing to the development of effective evidence-based communications that can help build healthy, supportive environments. This is Malvina's second appearance on the SeamlessMD podcast. Her first episode was on the nuances and intricacies of using digital patient engagement for bariatric surgery, which was episode number 17. Today, we are especially excited to have Malvina back on the pod to discuss some of the nuances in using digital patient engagement for endocrine surgery. Malvina, welcome back to the show.
Thanks for having me back.
Well, Malvina, you did such a great time last time that, as soon as we finished recording that, we put it on the calendar that we have to have Malvina back on the show. Today on endocrine surgery, which we're all excited about, and I can feel my adrenal glands running, and we are super excited to get into this show today.
I'm excited too. Let's do it.
I was going to say thanks, Malvina.
Yeah.
But you beat me to it.
Well, I saw your face moving, and I was like, oh shoot, I just totally cut you off, but that's all good. Malvina, before we start, I just wanted to frame the discussion a little bit. Endocrine surgery contains a variety of different procedures. So I'm just curious, which ones are we focused on currently at SeamlessMD, and or which ones are we going to be focusing on the discussion today?
So we do have, I think, a bit of a focus on adrenal surgery, thyroid surgery, and parathyroid surgery. Those are the 3 that I think we've been working on the most recently. So, yeah.
Cool.
Right. We have 3 podcasts we can get out of this then, right?
Yeah, we're gonna stretch this into 3. We'll cut it up. No, I think that's good.
There's a lot.
Definitely, yeah. So we do have a lot to cover. So, but we want to do it in a fairly methodical approach. So, I think where we can start, Malvina, is understanding a little bit about endocrine patients in general, from past endocrine surgery patients, what they've cared about, concerns that they might have had. Do you think you can start the conversation there and help us understand what our endocrine patients really care about?
Yeah, I've realized that the themes kind of gather around the different kind of surgeries that they have. So, for example, adrenal patients, I've realized a big concern for them is understanding the specific instructions for their specific tumor type. So an example of that could be like tracking blood pressure and heart rate. Not all adrenal patients need to be concerned about that, but the few that do, that'll be a bit more of a focus for them. And maybe for thyroid and parathyroid patients, I found that there's a lot of focus on symptoms related to low calcium, medication compliance, and even in the long term, like for example, 2 to 3 months after surgery, they could still be having or needing these follow-ups on these topics. I would say that a general theme for all 3 would be that they all really care. They wanted more information on the blood tests, when to get them, why they're important, especially because these patients are followed up with for such a long period of time after surgery. That's something that did come up with a lot of the patient concerns.
And Malvina, question for you, just more on the demographic. I think I've been reading that, even though a lot of times you're doing this to support patients having cancer, whether it's maybe like thyroid cancer or something like that, it tends to be a younger population than some of the other cancers type surgeries that we support. Is that fair to say?
From my experience, yes. They've definitely been younger, and that makes them, from what I've seen, extremely tech savvy for stuff like our platform. I don't think we've had a lot of caregivers enrolled, for example, to help with that follow-up, stuff like that. Yeah.
Does that, I'm just curious, does that actually change the way you think about how you design these programs? Like, are you actually intentionally designing it differently if you know the average patient is, below 60 as opposed to above 60, or are kind of all the principles generally the same in the approach?
For me personally, I've been keeping it the same just for one reason. I don't want to focus on a younger population and then maybe have those odd outliers that might be a bit older. And I don't want older patients to run into issues just because we've maybe tailored it to a specific population.
Right. Yeah, and I think one of the things that I think we maybe lucked out a bit in Seamless is that even from the very beginning, I think we've sort of had that stance just because we started off doing a lot of high risk surgeries with older patients. So, we started off doing, colon cancer surgery and lung cancer surgery and all that. And so I think to your point, Malvina, we've always started with the mindset of, well, if it works for the, oldest, frailest patients, it should definitely work for the younger patients who use Seamless. Whereas I think if we had started the company focused on, I don't know, like ACL repair or something that would be more common in a younger patient, we may have designed it almost too much for a younger tech savvy population and probably would have had gaps in the product that would be difficult for an older patient. So I think we actually kind of lucked out there, and it sounds like we may have kept that same mindset ever since.
Yeah, I think so too. I believe our department kind of all follows the same sort of mindset, which is good, I think.
Mm-hmm. Definitely. So with digital patient engagement, I just want to shift the conversation to specifics on digital patient engagement and how it specifically reaches out to endocrine surgery patients and helps guide them through their surgery journey. As you said, Malvina, it is a long journey. There is a lot of post-op follow-up, and there's a lot of instructions for the patient to follow both pre and post-op. How do you go about designing an endocrine surgery program to tailor to these unique patients and these patients with concerns like you mentioned around specifics for adrenal and specifics for thyroid and parathyroid? Is there anything that you can talk about that's kind of unique to endocrine surgery as opposed to other general surgeries?
Definitely. So I think depending on the endocrine surgery that we're building towards, we try to include unique aspects into the program. So for adrenal surgery, just because of all the patient concerns with all the different patient instructions depending on their tumor type, we program the platform to differentiate between having, for example, like a non-functional tumor, a pheochromocytoma, an aldosterone-secreting tumor, and a cortisol-secreting tumor. And the program is smart enough to know what kind of tumor you have based on how the provider enrolls the patient. And from there, we'll only include instructions for that specific patient population. So an example could be like for a pheochromocytoma patient, there are all these additional pre-op instructions on maybe having more sodium and liquid in their diet or taking an alpha blocker or some form of other blood pressure medication. We will make sure to only set up those reminders for those patients and follow up with these medications to make sure that, for example, they've stopped taking them after their surgery.
Right. And so that would only be applicable to those patients that are in that kind of subset. Is that how it works?
Yes, exactly. The program will be smart enough to differentiate that this is only these specific patients need this information, and it'll only be sent to those.
Got it. Anything in particular for like thyroid patients or?
Yeah, so for thyroid, we do build it, I guess, with a similar mindset that the program can differentiate between people who had a lobectomy surgery, so when only half their thyroid is removed, or a total thyroidectomy, which is when the whole thyroid is removed. And if, for example, they needed a neck dissection on top of that, or if they've originally had Graves' disease, it can differentiate between all those things and make different combinations of patients. So, for example, a patient with Graves' disease and had a total thyroidectomy, but maybe not a neck dissection. And depending on the characteristics of the patient and what the patient needs, it'll differentiate. So, just as another example, patients that get a total thyroidectomy need to get constant reminders to take their thyroid hormone replacement medications after surgery and calcium supplements. So we check for these compliance in that post-discharge health check survey that's sent out 30 days after. And we also check for symptoms of low calcium after surgery. So that's something like numbness and tingling in the extremities or muscle cramps to make sure that the patients are actually keeping up to date with their medication.
Right.
Malvina, can I ask you, do you know, like in a non-seamless world, like a regular patient journey world, in terms of the materials education that patients normally get, um, do the current paper-based versions get personalized to the patients in any way, or do they just basically get everything, and then they have to kind of filter through, like, is this content on calcium supplements relevant to me or not? Do you have a sense of what people are normally doing right now in a hospital, for example?
Yeah, and I think that's a great question because from my experience, I've realized that there is some form of generic information that's provided to all patients. But in terms of these nuances that only these specific patients need, it'll tend to be more verbal from either their surgeon or someone on their healthcare team that's telling them to follow these instructions.
Mm.
It's not common that they'll have these personalized pieces of education materials on all these small little things.
Mm.
How about when the patient goes home? Like, do you know, like normally, because I think one of the unique things about Seamless is that like you're actually asking and empowering patients to track certain symptoms or data points. So tracking, let's say, signs of low calcium or other things. Do you know if patients are normally asked to track stuff like that? Or are they just not doing any of that because there's no easy way to do that on their own without something like Seamless?
I've seen two different things happen. So for things like maybe low symptoms of calcium, from my understanding, it tends to happen more, again, verbally, like when the patient comes in, have you been experiencing these things?
Mm.
There are these extreme situations where if the patient is having really extreme symptoms of low calcium, the healthcare team will let the patient know to call them at that point. They'll give them steps of what to do, and it's pretty much just helping them get that extra calcium before they come to see them next. But then on the other side of the coin, there's things like, as you mentioned earlier, patients that need to check their blood pressure and heart rate every day. They might get like some form of tracking sheet to follow through with that, especially in the beginning, right after they are discharged from the hospital. I've seen that more commonly with adrenal patients, all adrenal patients, maybe except for the non-functional tumors, people that have the non-functional tumors, they'll be asked to track their blood pressure and heart rate.
You know, the crazy thing is, so like, I was reading some of like the common like let's say post thyroid surgery, like patient FAQs and stuff. And so like it tells you a lot about, like you just described today, signs and symptoms of like hypocalcemia or like low calcium in the blood. And what do I do? What do I do if I have those signs and symptoms? How common is that? And like I'm a I guess technically clinical by training, right? And so I'm lucky in that if I read this stuff, it makes sense to me. But if I had something like thyroid surgery, I would read this once, frankly. I would read it once, and I don't think I would retain any of this stuff even. You know what I mean? And I don't think I would even necessarily recognize, like, for example, even though I'm post-op, if I have certain signs or symptoms, I don't know if I would even necessarily even connect that to the fact that I had surgery, because there's so many symptoms that are kind of like non-specific, like could really be like connected to any other health condition or stress or anything else. And so like I kind of like, I mean, I'm biased because like I'm part of the Seamless team, but it's just it strikes me that as a clinical person, we hand these things to patients, and because if I'm a clinical person on the surgery team, like I'm an expert on endocrine care, so like I know all this stuff inside out. But the average patient is not going to recall any of this stuff. They're going to read it once, hear it once from you, probably forget it, and not really be proactive. And even I, again, like I don't remember anything that I read. Um, and so like I love the fact that on Seamless, like you're actually prompting the patient to like, hey, like check on these possible signs of hypocalcemia, or you're like prompting them with like bite-sized pieces of like what to expect. It's just I don't think humans were designed to process all this clinical information and remember it. You know, that just seems really hard. It's hard for me. It's probably hard for someone who's not clinical by training.
I would definitely agree, especially for those non-specific things, like something like a headache. You might think that, oh, whatever, I just have a headache today. You won't really think of what's the cause of that. I think I'm biased as well to our program, but I think another great example is like adrenal patients that have cortisol-secreting tumors, post-op, they need to check for things such as muscle weakness, word-finding difficulty, like slow heat, acne, things that, again, as you mentioned, they're really not specific at all. Someone might think, oh, I'm forgetting a few words. It's not a big deal. I'm just tired today. But in reality, it could actually be related to their surgery. So I think it's great that we have the ability to check on these patients consistently with all these, I guess, small little symptoms that they may be experiencing and telling them what to do about it. Whether it's as simple as, hey, just make sure to talk to your surgeon at the next time you follow up with him.
I think something else that's neat, specific to SeamlessMD, but I'm sure it could be incorporated into other digital patient engagement as well, is having the content written at a certain grade level. So with SeamlessMD, it's a grade 6 or below reading level. To Josh's point, a lot of this information is very difficult to comprehend. And if I were a patient going through this procedure and it's, you know, something that's very, very specific and very clinical in nature, it would be awfully difficult to understand some of that information.
Yeah, Alan, so like right now, like I just pulled up an example, you know, after thyroid surgery, like patient education material from an academic hospital. And they use words like contraindication, which is like, if you're clinical, like, you know what that means. But if you're non-clinical, it's like, what? I don't know what this word means. And it's on my patient pamphlet. It's crazy. Yeah. I think it's, I mean, I'll be honest, like, I think most people who are clinical aren't trained in things like health literacy or education, the way that, you know, folks on our team like Malvina are. It's just not, it's not something that time is invested in. And then that extends to when we create these materials for people normally.
Mm-hmm.
For sure. And I think it's also a mindset thing. Like, even when I worked in the hospital, it's sometimes easy to forget that when you're talking to a patient to use plain language, and it takes, I think, a conscious effort to remember, because at least from my experience, a lot of patients don't feel comfortable enough maybe to ask, hey, what does that word mean? What does contraindications mean? They might just take it as it is, maybe make some form of understanding based on context,
Mm-hmm.
or just think, oh, it's fine, whatever. I don't need to know what that is.
Right. Yeah, which could lead to problems down the road. Totally. So we've alluded to already that there's unique education put into the system for endocrine surgery and unique surveys that have been put in. Could you talk a little bit about the specifics of that? So specifics around maybe education that you built for adrenal patients, for thyroid patients, and or specific kind of survey questions that are unique to those procedures?
Yeah. So I think a big one is, for that symptom tracking questions, we do differentiate it based on, for adrenal patients, based on the specific tumor that they had, like I mentioned earlier. For thyroid patients, a good example is people who've had neck dissections. So they get discharged with a surgery drain. So for people like them, we need to give them specific education on the surgery drain, how to take care of it, at what point do you need to feel worried, like when you're checking into the output that you're getting. We remind them to check on it every day. And for that symptom tracking in the post-discharge survey that we have, we'll ask them about how much discharge are they having, what's the color of the excreted liquid, etc. And based on that, again, provide them with the self-care tips if they need it, or refer them to their healthcare team if the symptoms are worrisome.
Right, got it. And my understanding for pretty much all of these different procedures, there's some form of potential hormone replacement medication as well. With any kind of change like that to the day-to-day schedule that, you know, a patient has to follow and adhere to with medications and stuff, I imagine there's quite an emphasis on certain reminders, when to take these different supplements, when to take their medications, and how to take it, and things like that. Are there specifics in terms of diet and how you build these reminders to change with the patient over their journey?
Yeah, so that comes down to a lot of the differentiations that we have between patients as well. So like we've just been talking a lot about calcium. So patients that have their whole thyroid removed will include a lot of education on different food sources and different the specific supplements they need to take in case they need to take a specific form of calcium, for example, and the doses that they need to take on, what to do if they have low calcium. All that information is included, and we check in on all those things in their post-discharge survey as well. I think another good example is like patients who have Graves' disease. They need to take supplements even before their surgery. So they'll be on vitamin D supplements. So we also give them education on that. And sorry. Hey. He was growling. I was going to lock him out of the room.
I thought it was my stomach, but I heard the growl.
Okay. Here, sorry.
You were talking about how they have to take certain supplements before surgery, like vitamin D, calcium, and education around that.
Yeah, so we provide them education around the calcium supplements, the vitamin D supplements, why they need to take these before surgery, and why it's important to stick to the information that they got or the instructions that they got from the surgery team. And based on that, we also take it a step further as to make sure that they stop taking any unnecessary supplements or medications after their surgery, just to, again, avoid any unnecessary post-op complications.
Right. And Malvina, you've mentioned a lot about these post-op surveys that a patient is doing. I know in the past, like we've referred to these health checks or the kind of symptom tracking head to toe check that we're asking patients so that you can find out different complications or potential warning signs or just recovery status in general. Could you talk a little bit about some of the unique surveys and or some of the validated surveys that you're including with our endocrine patients as kind of the common set for endocrine surgery?
Endocrine surgery is actually one of our, I think it has a unique aspect when it comes to surveys because they do have all these long-term follow-up appointments.
Mm-hmm.
So for example, before their 3 or 6 month follow-up, we do have these additional surveys that go out to the patient to check in and see if they have any of those common long-term symptoms that they're still experiencing after surgery. At that point, we also do include like an additional thing of blood work because again of these long follow-up appointments. That'll be something that could be paired with that survey. And this allows for the surgeon to just monitor the patient remotely and see how they're doing even before they show up to the appointment.
Right.
Additionally, we do.
Sorry. No.
I was going to say, additionally, we do have a validated quality of life survey that we do send out to endocrine patients. It's called the SF-36. That's short form for a 36 item short form health survey.
Yeah, very short. Yeah.
In healthcare, 36 is short.
We take
how long the long forms SF survey is.
SF 100, yeah.
So that's a good example of a survey that actually gets sent out to patient quite often. So I think it happens 1 month before surgery, 1 month after, and then 6 months after surgery, they'll be followed up with this validated survey.
Gotcha. And in terms of the, you mentioned how surgeons are able to monitor their patients remotely, see these kind of symptoms from patients, see how they're recovering over time and in the long term as well. Do you know if there's been situations where certain follow-up appointments are almost not necessary anymore if they are able to get this information remotely?
I haven't followed up with any of the surgeons since COVID has hit, but I would like to think that this would be helpful, especially because I know a lot of people are doing remote patient visits, like video visits. So I'm hoping that this would be helpful in this realm, in this new time of healthcare.
Mm-hmm. Yeah.
Can I give you a fun fact?
Yeah.
So just because Malvina brought up the SF-36, so there are actually some shorter ones. So there actually is an SF-20 and there's an SF-12. So there actually is a very, very short form of this. But the reason why the SF-36 is still considered a short form is that the very original survey set was 106 questions. It was from a multi-year study of patients called the Medical Outcome Study. And so that they originally had a 106 116 question survey, and then they validated these shorter versions of it.
Right.
So, maybe we should do something where we give the 116 one. Wouldn't that be fun?
I'm sure we'd have a high compliance rate to
Yeah.
that.
Yeah, I was going to say that's most likely why they've shortened it, and they've found, these 36 questions are the most important, but kind of that balance between compliance and value in the survey itself. In terms of patient feedback, Malvina, I know at SeamlessMD we're really big on interviewing our patients and hearing from them and understanding what could be improved in the platform and what they enjoyed from the platform, and or not enjoyed, but really valued the most. Could you talk a little bit about what the patient feedback has been so far with the endocrine programs?
It's been, I went through the patient feedback before talking to you, and it was interesting to see that we do have great patient feedback in terms of some of the common things that we see in Seamless in general. So helping the patient know what to expect, like during their hospital stay and when they go home, is something as simple as reassurance that they're healing normally, which is amazing for things like wound photos and being able to compare their wound to photos of wounds that are healing normally or those that are actually infected. I think that was some of the bigger things that I've seen, especially for this patient population. Yeah.
Well, and I imagine, like, obviously stress is such a big part of this patient population. And so anything that would mitigate stress or help them out, reduce anxiety, help them feel like they have a sense of normalcy and know what to expect, and things like that go a long way.
For sure. And I think that's exactly why we're getting patients telling us that they found this so helpful. It's because I think it sticks in their mind the things that maybe they see here that are unique compared to maybe what they've experienced or what they imagine a surgery process to be like. So something as simple as including these wound photos, it's not something you will even see if you were following up with a surgeon like every day, because they're not going to be showing you wounds face to face, I think.
Right. It's like very empowering.
Yeah.
Makes sense. All right. Josh, did you have any other questions, or otherwise we can jump into the fast five, Malvina?
No other questions. This was fantastic, and I'm glad we had a chance to do another one with you, Malvina. Really appreciate all the time you put into this.
Thanks so much for having me. It's honestly so much fun talking to you guys on this.
Well,
really? Okay, I think she just signed up for another one.
She signed up for another 5 in a row. But I think also it's nice, Malvina, it's nice for us to highlight you as well, because you do put a lot of work into these programs. You have talked with endocrine patients, you have talked with endocrine surgery teams, and designing this information that's very specific to each patient and personalized to the patient obviously takes a lot of work. And so it is something that we love highlighting, the jobs that you've done really well in, and not to suggest that there's jobs you haven't done well in, but definitely with endocrine, it's been a big success as well.
Honestly, I've loved working with them. They usually tend to be these smaller teams of a few people that are very dedicated and very passionate. It's wonderful to see.
Amazing. So at this point, let's jump over to the fast 5 questions. This is basically a lightning round where we ask you 5 questions. The first question we have is, how has a failure or apparent failure set you up for later success? Do you have a favorite failure of yours?
I do have a favorite failure because it was the worst time of my life, but I think framing this question, it was something that I think led to later success. As I was working towards becoming a dietitian, I didn't end up getting an internship, which is something that we need to get registered. I didn't end up getting it the first year after I graduated, and I was devastated. I think this is very common in our profession that most people don't get it, especially in Canada, because there's it's very few opportunities. But during that year, I think I was able to do so much more than I could have imagined in terms of not just working on my nutrition related skills, but even just working on myself and something as simple as what I look for in a job or what I want my next 5 steps to be, rather than this internship is just my next step, what's going to come after. I needed to work on more of a long-term plan, and it gave me the ability to do that, while I think allowing me to mature in ways that maybe someone coming straight out of university doesn't get to do right away.
Yeah.
Kind of like if you're like running on a treadmill or something, and you don't really have time to stop and think about like maybe treadmill is a bad example, but I think you might point. You don't have time to stop and actually like look at things from like a
bigger picture
perspective, because you're so focused on like staying on the treadmill, not like falling off, like keeping the same speed, or to step outside that. If you don't have, you're not forced to do it sometimes, I guess.
Yeah,
I think that's what happened. Yeah.
I was gonna say answer at first, but then
I like the treadmill analogy. Maybe you're on speed 6, and if you take that minute to stop and reset, you can actually find a way to get to speed 10. You know, but you needed to kind of do that reset first. Makes a lot of sense.
And a hamster wheel. So
yeah. Just goes around and around.
I was just gonna say, like, this treadmill analogy is just reminding me, even something that we do now is just try to avoid burning out. Everyone has burnout, but now you just need to see the signs and try to find ways out of it.
Yeah. I think this episode is perfect for this topic as well, talking about anything to do with adrenals and burnout and you know, fatigue and stress. So relevant. All right, question 2, Malvina. Would you rather have invisibility or super strength?
That's such a hard one. I think I would want invisibility. I'm a little bit of an so I think that's the only reason why. It's like sometimes you just want to go along your day and not need to bump into someone at the grocery store.
Would you use it in any other ways, or
like nefarious ways?
Yeah, nefarious ways. That's what I'm hinting at.
I think probably, like, I think after I get used to it, I'd probably end up just trying it out, seeing what I can gain from having invisibility.
Yeah, you can't get that with super strength.
No, exactly.
You can cut line in the stores during COVID if you have invisibility.
That is true.
All right, question 3, Malvina. What is your favorite movie?
I don't know if I can answer this question. I'm more of a TV show junkie.
Okay. So, what about favorite TV show or TV show you'll binge the most?
This is a very common answer, but I think currently my favorite TV show is This Is Us.
Okay, yeah.
Despite being around for a while, but I think other than that, it'll be like The Office.
Right.
Classic.
Yeah. I've not seen This Is Us, but I've heard it's kind of depressing or sad, maybe.
I like calling it a tearjerker. Like, if you're in need for a good cry, it's a good show to watch.
Right. Cool. Question number 4. If you could live in any other period of time, when would it be and why?
1920s, hands down.
Just the roaring 20s, yeah.
Yeah, I wanted to experience what it was like during like Prohibition, the movement of freedom, just the whole thing, and like it seemed like such an exciting time to be alive.
Yeah. I'm looking at Josh. I don't have anything to add to that. I mean,
I'm actually trying to think about, like, I have a hard time answering that question. Like which time? I'm actually really excited that Malvina, like, you actually knew what you wanted.
It was so fast too. Yeah.
For sure, the 1920s, and I'm just like, I don't even know how I would answer that question. There's like so many decades to choose from.
Yeah, I would probably say in the future. I would probably say like, 2300. That's the year, or 50, 5,000, year 5,000.
Whoa. Everyone's gonna look so different in that year.
I've had this a lot. I've thought about it a lot. That's why I knew right away.
That's great. Last question that we have, if you could have a gigantic billboard anywhere with anything on it, so metaphorically speaking, getting a message out to millions or billions of people, what would it say and why?
This is going to be a bit of a deep answer, but that's because it's something I'm personally very passionate about. It would be something along the lines of, you don't know what other people are going through. And sometimes people just need to be reminded of that.
Yeah.
So be simple and straightforward. I think that's what I would say.
You know, Malvina, based on that answer, Alan, I feel like the next time we have Malvina on, we can ask her question number 2 about superpowers again, but I think we can add a third one, be like, would you rather have invisibility, super strength, or the ability to read minds?
Oh, that's a good one.
That's an interesting one. Or actually even better, like, what if you couldn't turn it off? Like,
Yeah, I was gonna say that could be like a Twilight Zone episode where it actually becomes a curse. Like it's actually, that's interesting.
I also watch a lot of like superhero like movies and shows. So these are things that these are good points that you're bringing up.
Malvina's already thought about all these already. She's all,
Yeah.
I've thought about that. It's invisibility.
Yeah. Still
I'm
invisibility. Yeah.
cons of this.
Yeah. Oh, that's great. Awesome. Well, Malvina, thank you so much for joining today, talking with us about endocrine surgery and the nuances and intricacies of digital patient engagement, how you've built it to accommodate this population. Really valuable insights. I learned a lot. I hope our listeners learned something as well. Do you have any closing remarks or?
Not really. I just want to thank you guys for having me again. It's always a fun time talking to you. And honestly, I'm excited to be working on more endocrine programs. Maybe we'll focus on some other ones too, and we'll have a lot more to say next time.
Awesome. No, this is great. Thanks, Malvina.
Thank you, Malvina.
Bye.
Yeah.